Megan. I got a message that you were having some complications due to, well, not entirely known, but some complications, possibly with your medications, that the main practitioner had prescribed to you regarding your neck pain. Okay. Now, when you left the voicemail, you said that you were incurring migraines, headaches, that the tension and the pain behind your eyes has not subsided. Okay. Have you been able to sleep? Okay. Okay. Have you been experiencing any kind of dry mouth? And what dosages are you currently taking them at? And are you taking the full dosages most of the days? Okay. Have you found if you lower the dose, if you have any other, does the pain seem worse? Does the dry mouth seem worse? Okay. Alrighty. Well, let's see if we maybe can get you fitted for a more comfortable neck brace and something that you can possibly wear while you are sleeping. I do very much believe that sleeping plays a huge part in any kind of recovery. If you are sleeping in an awkward position and subsequently your muscles never really get the opportunity to fully relax, you are going to have that pain continue until you're able to get properly seated. Alright, well, let's get you measured for a new neck brace, and then we'll try that for a day or two, and maybe I'll see you in 3 to 4 days, whatever is convenient, and then we can do any kind of adjustments that you feel are needed. Okay. Another thing that we do with some of our neck braces is we actually put a little bit of purple dye. It's kind of a new technique, but the purple dye will sit in the cushion materials and it will leave very small imprints about your skin and give us a good indication of where there's excessive pressure. So most of the time when people wear neck braces, right here on their jawline and in the back of their skull by their occipital ridge, a lot of people experience pressure sores, and that's something that we definitely want to avoid at this point. Okay, well, let me get the office set up out back, and we'll take you in about 2 minutes, okay? Alright, see you in just a second. Okay. Well, the first thing is, can you describe to me what your sleeping patterns are? Do you normally go to bed at a certain time? How many times do you usually wake up in the night? Okay. And before the injury, approximately what time did you usually go to bed? Okay, so really not that much earlier. And before the injury, how often would you usually get up in the middle of the night? Okay, that's normal. And when you would go back to sleep, would you sleep for a solid block of 2 or 3 hours, or would you stay out longer? Okay, and now in comparison to your injury now, do you have many interruptions in the middle of the night? Okay, you do. Okay. 3 to 4 times? Is it mostly due to pain? Okay, and dry mouth? You're waking up a lot to drink? Subsequently, you're waking up a lot to go to the restroom? Yeah. And the physician that initially was treating you, they did give you a generic brace, but you believe it's a little bit too loose, right? All right. Well, my main concern is that if you don't have a properly fitting brace, that you're going to eventually incur swelling. Swelling is not something that we like to see with any kind of spinal trauma. As long as you're not experiencing tingles, loss of sensation, or losing certain bodily functions, then I think that you're probably going to still be in the green. But I do see that you have 4 medications that you're currently taking. Are you taking them as prescribed? You have the morning pain reliever, the afternoon pain reliever, the steroid for inflammation, and then you have a sleep aid. Okay, are you taking the sleep aid? It makes you dizzy? Yeah. Do you have anyone else in your household that may be able to help you with any kind of massage techniques before you attempt going to sleep at night? Alrighty. Okay. Well, my main objective is to measure you for a properly fitting brace. Something that's comfortable enough that you can wear while you're sleeping. It has a unique dye that will very lightly, it's not going to dye your skin permanently and it's not a long-term thing, but it will leave little indicators as to where you have excessive pressure. And another thing that we want to avoid with any kind of brace is pressure sores. Pressure sores only complicate injuries, they compound injuries, and that is definitely something that we want to avoid. Speaking of pressure sores, though, are you still mobile enough where you're active enough to keep the backs of your thighs, your bottom, any tender spots on your back where skin is starting to break down? No breakdowns. Good. Yeah, I know that moving is very unpleasant at this stage, especially with any kind of nerve damage. Not so much damage, but irritation even. You might get some twinges of neuropathy, which it's a very, very unpleasant type of pain, but movement is absolutely crucial, especially in this stage. Once we can get the inflammation under control and you're no longer at risk for any type of paralysis, then we'll move on to the more aggressive physical therapy. But in the meantime, I'd like to get you a new brace, a TENS unit to prevent from any kind of muscle atrophy, also to increase circulation and just overall flexibility. Recommend some nightly stretches since you may not have anybody on a regular basis to help you relieve certain muscles. That may actually be a good thing because we don't want somebody that is inexperienced trying to rub a muscle the wrong way and actually causing more pressure in areas that we don't want. And then see if we can come up with an alternative for those sleep meds if they're going to be causing you to become dizzy and possibly nauseous. Okay. Well, anytime that I see my patients, I want to just take some of your vitals. Make sure that you don't have anything that is building up like fluid in your lungs, and just test your breathing. So, do you mind if I take a listen? Alrighty, breathe in for me. Good, good. In and out. Alright, now I'm going to go a little bit lower here. And out. Okay. I'm just going to reach around you a little bit. I'm going to turn you to your side a little bit so I can get to your back a little easier, okay? In and out. Alright, a little further around. In and out. Alright. You do actually sound a little bit congested on the lungs. I'm really hoping that it's just a temporary, possibly fatigue. Have you been coughing at all or anything? With a dry mouth, you find you've been coughing a bit more? Okay. And you're staying hydrated. You're drinking at least 8 8-ounce glasses of water. Probably more. Okay. All right. So it's probably not likely due to dehydration. All right. We're going to take your blood pressure again. Just going to slip this on your arm here. Okay. Now go ahead and take a deep breath in and just relax. Relax your arm. There it goes. (133/84). That's about what it was last time. A little high. Okay. I'm just going to place my hands on your neck and I'm going to feel around for any kind of hypersensitivity. Please let me know if there's any areas of differing tenderness in comparison to what it was the first time that I examined you, okay? Okay. Right here in the back of your neck is very warm. Is that a tender spot? Okay, now I'm going to place my hand on your chin and I want you to just completely relax the muscles in your neck. So just imagine that I'm holding your head and then just let me move it around a little bit and you tell me when it is uncomfortable to the point that you can't stand it anymore, okay? This is going to be somewhat of a tender process, but I really want to see any change in the range of motion, okay? Alrighty. So I'm going to start here, and I'm going to just tilt up, and around. Alright, your range of motion is actually pretty nice. Now I'm going to take this again, I'm going to place my right hand on your chin. It's a little bit stiff though, isn't it? That's a good angle though. I'm really happy to see that at least we're getting some good range of motion here. Okay. Alright, I'm just going to tilt your head because I remember this was somewhat of a tender spot for you, so I'm going to tilt it this way and I'm just going to press my fingertips into the side of your neck here and see whether or not we can loosen up some of these muscles. Your head down here. Okay, is that a little more tolerable? No? Okay. Yeah, no, I don't take offense to that. I realize you're in pain. Has nothing to do with the massage. Okay. So right now I am going to take my ruler and I'm going to just measure the radius of your neck, okay? Okay, now this is going to go down to your collarbone because ideally we want to have a neck brace that can come down almost to your collarbone area. Okay, and I'm going to measure just higher. Okay, now length from, can you please lift your chin up for me just a little bit? Okay. Now measuring from your jawbone down to your collarbone. Keep your head up there for a second. I'm going to check on your other side. Alrighty, go ahead. Get comfortable again. Okay. I'm going to take my little calipers. I'm going to put this on each side of your jawbone. I'm going to measure your jawbone separately, okay? Okay, and then again, clavicle. Okay. I'm going to turn your head again. I'm going to measure the back where your occipital ridge is, right where that little gap is. And then I'm going to measure it to right about where your shoulders meet the back of your neck tissue, okay? So I'm going to turn your head to this side here. So that's it for the measurements. Alrighty. Let's bring you back over to a comfortable position here. Alright, very similar to last time, I'd like to finish up this exam with a little bit more of a relaxing aspect. I'd like to spend just a couple of minutes here to massage these muscles here. These muscles are usually very much neglected in any kind of massage, but these are also the muscles that hold up the sides of our heads, not just the ones that are in the back that normally someone like a masseuse or masseur might focus on. So let's finish this up with a nice massage, and then we'll give you a topical cream. If you are feeling up to it later in the evening, this type of a massage, I'm going to describe some of the techniques that you can use that will not harm your spinal cord in any way, okay? Alright, so the first thing that we're going to try doing is we're going to massage these side muscles. And if you feel the sides of your neck, so you have a string of these muscles that come downward. Now these are not the ones that are directly linked or connected to our spinal column. So if you're experiencing neck pain, these are the muscles that will sometimes bring the most relief. Also keep in mind that you have your lymphatic drainage system that comes from our sinuses here, up our cheeks, right where our earlobes are here, down our neck and near our clavicles. So as you're massaging, a lot of the times going in this motion is going to be ideal. Okay. Alright, so let's get to the fun part here. And you can always just close your eyes whenever it's convenient, okay? Okay. This is a tender spot right here, isn't it? Okay. I'm going to massage around this area, not so much on that spot directly, but some of the areas that are neighbors, okay? Breathe in for me. Sometimes just a good deep breath makes it a little bit less painful. I'm going to go ahead and tilt your neck again because I think that this side is probably the most problematic, okay? Okay. Just going to hold your head. Just relax, rest your cheek on my foot, on my palm, okay? Just long strokes. And with a neck injury, if you do decide, or if there's a family member or friend that can do massage on you, just avoid directly touching the spinal area right in the center. Breathe in. And out. Let that pain out. Let's try doing a little bit of a rotation. Keeping it at an angle, okay? You okay? Alright, I'm going to hold your face. Actually, I'm going to use this hand now, and I'm going to go in from the other side. Okay? Just breathe in for me, nice and deep. And let it out. There you go. Alright, it's a little bit easier to move. Okay. Can you back your head up again? Try to touch your chin to your neck. Okay. Alright, now there's one last test before I want you to go. Because you've been experiencing a little bit more pain, I'd like to do a very basic test that we do with neurological and spinal trauma patients. I'm going to take a cotton swab and a pin, and I'm going to touch the surface of your fingers, and I want you to tell me which one it is I'm touching you with. Okay, so we'll start with your left hand. How about this one? Okay. And here? And here? How about here? Can't feel that well. Okay. What do you think it is? Correct. How about a little higher up right here? Okay. See your right hand, please? How about here? 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 Can you feel that? And what one is it? Okay. Here? 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 Okay. Okay. Now, grab a hold of my fingers. I want you to squeeze my fingers as much as you can, okay? Is that it? Okay. Alright. Now grip on all 4 fingers. Got a little more to grip. Go ahead and squeeze. Okay. Now I'm going to try to push my arms apart. I want you to place your forearms on my wrists. I want you to push them together while I'm pushing apart, okay? Okay. And vice versa. I want you to push out. I'm going to try to push you in, okay? Okay, good job. Okay. Well, the good news is that your biceps and your triceps are reacting at full capacity as far as I can tell. I am a little bit concerned about the numbness that you're experiencing near your wrists. When I was touching your left wrist, you guessed that it was the cotton swab, and it was really the pin. Have you noticed any loss of sensory? The most common loss of sensory with any kind of spinal trauma is usually temperature first. When you're washing your hands, do you know what temperature it is? Okay. Okay. Well, in a conclusion, I'm going to hand off these measurements for a custom neck brace, and they usually take about 2 to 3 days to fabricate. So maybe we'll see you on the 3rd or the 4th day, and we can try it out, make sure that everything is nice and snug. If there's any areas that need adjustments, they have Velcro, and we can go ahead and make sure it fits nice and tight, but not so much that it's going to harm your breathing or circulation. I am concerned about the lack of sensitivity in your left hand. Not so much in your right, you guessed them all right, but you didn't realize when I was touching you at one instance. I would like to increase the steroids by about 20 milligrams per day, just to help reduce any kind of swelling that you might be experiencing along the way. Swelling it's kind of a risky characteristic of any kind of spinal trauma, and we want to keep that at a minimum until your the tension, the irritation in the muscles, and everything calms down. I'm not worried about it at this point. I think that if you were to start to lose other sensations, heat, cold, weakness in your grasp, if you notice that you're reaching for something and you're just not able to clench it, that's when I need you to give me a call, and we need to immobilize your neck. We need to keep you as immobile as possible, but I don't mean to scare you. We're not at that point yet. You're actually doing remarkably well. Also, try some breathing techniques before you go to bed to try to lower this blood pressure. And if there is any urgent updates that happen in the next couple of days, don't hesitate to give me a call. But if everything goes well, bump up those steroids and work on getting a little bit more sleep if we can. Okay, I know that's not always an option. We'll see you maybe in 3 to 4 days. Alright. Okay. We'll see you then. Take care now.